Now, in this evening's health report, Shamela Pullen looks at wound management.
A wound is an injury to the skin. Consultant emergency medicine physician at the University Hospital of the West Indies, Dr. Eric Williams, says various types of wounds are seen in the emergency room. The most common is laceration, where a blunt object causes the injury, or incisions, where a sharp object pierces the skin. Dr. Williams says outside of that, there are punctured wounds or bites from animals or humans.
When we see a wound, the first thing to do is to assess the wound. Assessment of the wound includes an inspection and examination to look at the characteristic features of the wound. It is always important to ensure that you take a proper history of the mechanism of the wound to rule out foreign bodies such as glass. So the wound also, depending on the site where it is located, can give an indication of how dangerous that wound is.
Dr. Williams says affected persons should be extremely careful as they can develop severe complications because of the wound.
The thing about a wound, if it is not treated early, then you're going to end up having complications like infections. You may also have a bad cosmetic outcome, and you may even have infection leading to sepsis, especially in some subsets of patients like diabetes. So it's important that it is treated and the best treatment is offered.
But of importance, Dr. Williams is of the view that persons need to learn wound management. He says there are a number of persons who are still not taking care of their wounds properly.
Patients with wounds, it's very important that the doctor thinks about tetanus toxoid injection if the patient is not immunized over the last 10 years, and some wounds will require antibiotics. And there are various dressings that we can apply and send in home the patient, such as the traditional sterile gauze dressing. But we have come a long way from that, Shamela, in terms of dressing, where we have now available semi-permeable dressing that can control the moisture level of some of these wounds.
With your health report, I'm Shamela Pullen, wishing you good health.